Other people come in. I think everybody knows me. I'm Jim Richards. Appreciate you guys coming. What we're going to talk about, what I'm going to talk about first is just general hormone therapy for both men and women. I spent a pretty good bit of time preparing this for women, but I knew I was going to have some men, so I've incorporated some hormones for men here too. Also, after I get finished, Anna Pitts, who is my mentor, person that got me started on something called isogenics, reluctantly, but so glad that I did it. It really transformation for not just me, but our family too. And she'll talk about what isogenics is, how it can help you, and also how it will relate to what I'm talking about too. Have any questions? It's very informal. Just raise your hand. We'll just talk about it as we go. But balance through, and again, I've originally made this for women, so men, guys, bear with me. I'll interject some male part in this as well, but really I wish every woman could hear just how important it is to achieve a proper hormone balance. When I'm talking about hormones, I'm not just talking about estrogen, progesterone, testosterone. There's cortisol, there's thyroid, there's pituitary things that need to be considered. So and unless you're totally balanced, it'll be difficult to lose weight. It'll be difficult to just get more energy. You can't look at a symptom and say, this is my problem, let's do it. That's the downfall, I think, of current medicine, is you go to the doctor and say, I have a symptom, well, here's a pill for it. It's not that simple. It's never been that simple. But what is menstruation? It's basically shedding. Estrogen's made during the first half, progesterone during the second half. And I've done a little bit of, well, quite a bit of studying on why men need progesterone too. Progesterone is only released during a menstrual cycle. Then there's a growth phase where the estrogen is a dominant hormone, ovulation, and progesterone cannot be made without ovulation. That's one thing you have to consider as a female. If you're not ovulating or you're approaching the premenopause phase, your progesterone levels probably aren't where they need to be. And menopause, premenopause or perimenopause can start literally decades before menopause does. And then you have the luteal phase, which is progesterone dominant. This is basically what I said in a chart. You can see how it ebbs and flows. This is why I say that hormone therapy and hormone balancing is not simple. You can't just look at a blood test of your estrogen and say, oh, your estrogen level's low, let's give you estrogen, because every 10 minutes you fluctuate. This is two different females, saliva samples taken over 10 minutes. Look, this person is 2 and now she's 6, so it's threefold increase in 10, 20, 30 minutes. Estrogen ebbs and flows, and what we try to do is to minimize these ebb and flows so that your body won't respond to it. We do that with adaptogens. We'll talk about adaptogens and just how important those are when it comes to weight loss. You want your body to not overly respond to stresses, to estrogen, to hormones, to enzymes. You want what's called a homeostasis body. You want to maintain as normal of a body as possible. And this further tells you just how complicated estrogen and hormone balancing is. We have to have cholesterol. Cholesterol turns into pregnenolone, which is the mother of all hormones, because from pregnenolone, everything differentiates all the way down to estriol, to cortisol, which is your stress hormone, even to testosterone. So it's not, it says simplified here, but that's as simple as it gets. And every time you see an arrow, there are reasons why the arrow goes from here to there. There are enzymes, there's vitamins, there's nutrients that are required to get from one level to the next. So what are hormones? Hormones are basically just chemical messengers. They just take a message from one cell and deliver it to another. That's all a hormone does. But there are specific receptor sites within the cell membrane. When that hormone comes through, it's got an affinity for that receptor, so it hits the receptor. When the receptor is hit with the hormone, it sends a signal on down. So it's just a chemical messenger. Make things even more complicated, 99% of hormones are bound to water-soluble proteins that allow for bloodstream transport, but not necessarily to deliver the message. You've only got 1% out there that can actually deliver a message because it's tied up. It can't deliver that message. So you only have 1% that's free to the target tissues. That's why it's important when you get your blood work to make sure that they're testing for free. It's very difficult to test for some hormones in blood work and get the free component of it. That's why saliva testing is important, because it will only test for what's free, what's available. But these are basically the hormones that we'll hit on. Estrogens, and there's 3 subtypes of estrogen, all of which have a specific purpose. Progesterone, which is the balancer of all hormones. Testosterone, cortisol, thyroid, DHEA, and as I've already alluded to, there's many, many others. So what is estrogen? It is the most researched hormone. We really haven't started researching it since about 1960. In the 1930s, they just thought they didn't even realize that ovaries produced estrogen. Men produce estrogen. You don't have to have ovaries to produce estrogen. We'll talk about where and why it's important that men should have their estrogen tested as well. There's a paradigm shift from, it used to think that all women were low in estrogen, that's why they were moody and hormonal, but men are too. So now there's a paradigm shift basically from about the 80s from a lack of to an excess of. Our environment is so ubiquitously full of estrogen and things that mimic estrogen, that if you're not detoxifying and getting those things out of your fat cells, you basically have estrogen excess. What's the purpose of estrogen? And really pay attention here, grow and multiply. We'll get back to that in a minute. That's the purpose of estrogen. It signals the cell to grow and multiply. It's a good thing, unless you have too high of estrogen without a proper balance. It is, of course, the sex hormone for female characteristics. It's what makes a woman, and so forth. The other functions of estrogen, bone, it helps to balance other hormones, concentration, mood, many, many things. So I'm not saying estrogen is a bad thing. It is needed. We have to have estrogen. The problem comes in when we have excess estrogen. What are the forms of estrogen that we are exposed to? Well, of course, the bioidentical. Bioidentical is basically a chemically produced estrogen in the lab that is chemically identical to what your body produces, or what your ovaries produce, what your fat cells produce. Of course, the other form of estrogen is phytoestrogens, which are plant-based estrogens. Soy, that's an excellent estrogen. That's why women shouldn't probably eat too much soy, because you may be overloading your system with estrogen. Not just women, but men too. Xenoestrogens, and these are the toxic and very potent estrogen-like. They're not estrogens, but they act just like super potent estrogens in the body. They're ubiquitous. They're every stinking where. In plastic bottles. Xenoestrogens that are found in what's called BPA. You've seen BPA free? You make sure you get BPA free, and I'll just give you a little tidbit. You know the little recyclable triangle that's on the bottom of bottles? Make sure it never says 3 or 7. 3 or 7, the way it's produced, yields the highest form of xenoestrogen.
Let me tell you something I learned last weekend. I went to a conference. There's only 6 canned foods that's not BPA lined. One of them's eaten, which is so it angles here. But every can is lined with BPA to keep the food.
And that's the word ubiquitous. They're everywhere. As he said, and I'll repeat it, canned foods, the lining, the little slick lining that's inside of that is BPA, xenoestrogen. Maybe why your estrogen levels are so high, yet you have menopause. Maybe why as a man, you're growing man boobs, because of all these ubiquitous estrogens that are out there. And there again, if you're not making efforts to get that out of your system through cellular detoxification and cellular cleansing on a regular basis, that stuff just stays in there literally for decades. And I have another, and I think some of you heard my talk on the toxins. I'll spend 35-40 minutes just talking about the problem with these xenoestrogens. They're almost unavoidable. Functions of estrogens, remember, it's for growing, maintains bladder, vaginal tissue health, stimulate growth of breast cells. And I'll get into the function in men in a moment, but responsible for development during pregnancy, decreases bone breakdown, it affects mood, cognition, and concentration, decreases thyroid function. When you have high levels of estrogen, even though your thyroid function or your thyroid levels may be normal, you essentially have low thyroid because your cells can't pick it up because all the work is being done to handle the excess estrogen. It also increases fat storage. Guess what produces estrogen? Fat. So you have estrogen producing fat, fat produces estrogen. It's a vicious cycle. You have to make efforts to get your estrogen level in a non-estrogen excess mode. The three forms of estrogens that we talked about, estrone, estradiol, estriol. When we compound our estrogens, we do a combination mixture of 20% estradiol and 80% estriol. We get the same effect with estriol, but it's a cancer preventative. It used to be that we would give nothing but just estradiol when we're doing compounding, but now we mix the two so that we get a weaker estrogenic effect, but still have the estrogen effect without having the overwhelming estrogen receptor affinity that hits it really hard. Estrogen receptors upregulate. I'm getting into pharmacology a little bit here, but basically this is I'm sorry, I have my little cat pointer here. This is, so to speak, an estrogen molecule. It floats around. There's an empty estrogen shell here. The estrogen hits this estrogen cell, or estrogen receptor, and right there is the hormone message that it sends into the cell. Every time one of those hits, another one will grow, and it's empty. So more estrogen is required to fill the estrogen burden that's not being filled. So the more estrogen you have, the more estrogen your body wants, because those receptors continue to multiply. So remember, the function of estrogen is to grow and mature. So if you have many of these open, your body wants more estrogen, and that's kind of the philosophy behind a hot flash. That's your body crying out for more estrogen. That's one of the philosophies there. And I keep going back to this to say this: unbridled growth and maturation of cells is the basic definition of what? Cancer. I don't like to throw that word around. But when you have unbridled growth and you don't have a balancing effect of estrogen, the cell's responsibility when estrogen hits it is to grow and multiply. Estrogen, we know, excess estrogen, we know, causes cancers of all kinds, even in men. And there again, I'm getting to you guys. Another thing to talk about is sex hormone binding globulin. Probably never have heard of that in your life, but it's very important. This is what the estrogen molecule hooks onto to be transported through the cell. So, do you want more or less sex hormone binding globulin? I'll answer that in a second. But it affects the amount of free estrogen, and it's influenced by external factors. What factors? We want high levels of sex hormone binding globulin. We want that estrogen to be moved and metabolized. If we have excess estrogen just floating around without properly being put where it needs to, without sex hormone binding globulin, then we have estrogen excess or estrogen dominance. Excessive weight will cause sex hormone binding globulin to decrease. Cortisol and stress. Cortisol is your ability to run from a bear. We don't run from bears, but we chase our kids, we take them to ball practice, we go to church, we have all the responsibilities of being a parent, a father, working, and so our bodies aren't meant to chase a bear for 10, 12 hours every day, go home, sit down and eat dinner and go to sleep. It's meant to chase a bear and recover. That's another thing that we'll talk about, that I have a talk about as well. But androgens, progestins, decrease sex hormone binding globulin, growth hormones, insulin resistance, alcohol, low fiber, high fat diet, all of which, we all know we need to eat a low fiber, high fat diet. Why? This is one reason. Because it helps to move your hormones throughout your system. It's increased by estrogen, pregnancy, thyroid hormone, and fiber. So we want high levels of SHBG. Estrogen dominance, and I've already alluded to this several times, but estrogen dominance is common during perimenopause and menopause. Why is that? Because women don't have progesterone. Even though your estrogen levels may be normal, if you don't have adequate amounts of progesterone, effectively you have an inordinate high amount of estrogen, so you have estrogen dominance. Anybody who's taken synthetic hormone replacement therapy or birth control to control, and those of you that have daughters or will have daughters, don't put them on birth control for acne. Goodness gracious. All you're doing is setting her up for all the things that we're talking about. There's no medical justification for putting anybody on birth control for acne. Estrogen dominance is also caused from higher prolonged stress. Remember why? Because cortisol causes a decrease in sex hormone binding globulin, therefore causing estrogen dominance, because estrogen doesn't get where it needs to go. Poor nutrition, when you don't have nutrition, remember all those arrows that I showed you in the pathway? Without nutrition, you don't have your vitamin Bs. Vitamin Bs are so important for moving those good estrogens to better estrogens and not to the bad estrogens, which we'll talk about. Toxins and environmental pollutants, which are, my favorite word is ubiquitous. It's everywhere. Estrogen dominant symptoms. If I had women here that were over 50, well, probably even less than that. How many of these can you check off? Rapid aging. Of course, you don't know you're rapid aging. If you look in the mirror and you see sagging eyes, that's rapid aging. But allergies, autoimmune disorders, breast tissue, cervical dysplasia, low libido, fatigue, irritability, insomnia, infertility, headaches, hair loss, belly fat. Also causes magnesium, zinc deficiency. Magnesium is responsible for many healthy things in the body. Zinc is your immune, gives you the immunity, the ability to heal, among other things. Water retention, PMS, sluggish metabolism, low thyroid symptoms. Remember I talked about, even though you have your thyroid function, you go to the doctor and say, "Doctor, I've got every symptom of low thyroid," and then your test comes back normal. There's something called thyroid toxicosis or Hashimoto's. That's because it could be because you have estrogen dominant symptoms and your adrenal function is not where it needs to be. Estrogen dominant symptoms of cancers, uterus, breast, cervix, and ovaries, fibroids, bone loss. If you're 40, and I think, well, you need to have a baseline bone density scan, and then have one every couple of years to make sure that your bone density is staying up. A lot of doctors don't want to do it until you get 50, but you need to know now so that you can start making some changes if you need to. So we're talking about excess estrogen in men. Same kind of thing with women. Excess belly fat causes excess estrogen. Gynecomastia, man boobs, and I found many studies supporting these excess estrogen in men. Double, and this is just for men, there's double the stroke risk because estrogen causes blood clotting, or high levels of estrogen will cause your blood to clot. This study found that estradiol found to be higher in male heart attack victims, along with the low testosterone as well. You know, we talk about with women estrogen being balanced with progesterone. Testosterone is the balancer of estrogen in men. Study measuring inner wall of carotid artery thickness over 3 years concluded that circulating estradiol is a predictor of progression of carotid artery thickness. When you have carotid artery thickness, you have narrowing of the vessels, which is heart attack and stroke. Another study, estradiol is higher in male heart attack victims. Low T increased conversion to estrogen, creating estrogen dominance. As we're younger, and I say before age 40, 45, we have adequate amounts of testosterone to balance the estrogen. But as we get older, more testosterone turns into estrogen. We have less testosterone, but we have more being converted. So most men are walking around that are over 50 years old with high levels of estrogen or estrogen dominance. It's not tested, and it really should be. Low levels of testosterone, or the testosterone estrogen ratio in free androgen index, and higher levels of estrone in men with coronary artery disease appear together with many features of metabolic syndrome and be involved in pathogens coronary. Anyway, it's saying high estrogen in men causes coronary arteriosclerosis. And I found, well, I've got 36 studies that I cited. I'm not going to say them all, but you know, I'm kind of beating a dead horse. Peripheral artery disease. For the first time, low serum testosterone and high estradiol levels are associated with peripheral artery disease. That's venous thrombosis and lower extremity blood clots. This study in '98 said it was found that men admitted to hospitals with a heart attack or myocardial infarction have elevated estradiol and low testosterone. That ratio is not where it needs to be. Compared with the control patients whose estradiol levels were 108% higher, while T levels were nearly 33 times lower. It's important for men to test your estrogen, not just testosterone. Estrogen is related to prostate cancer. Even though men that have prostate cancer or are diagnosed with prostate cancer are given estrogen as a therapy. This was a kind of a small study, but it tells us that there was an estrogen treatment results in high incidence of prostate cancer. The reason why is because prostate DNA damage happened 15 to 25 years ago. If anybody heard of a product called Product B, we'll talk about it. It will actually repair your damaged telomeres, which are the end pieces of your DNA strands that ultimately cause disease and cancer. If you can stop that progression of disease and anti-aging, then theoretically, if you don't get hit by a Mack truck, you're going to live pretty healthy for a long time. Estrogen exposure in the womb, you know, there again, it's ubiquitous. If a man gets, if an embryo gets exposed to estrogen in the womb, we have studies to show that they have an increased chance for having these estrogen excess type diseases and cancers. How does that happen in men? Estradiol is converted, is from converted testosterone. You know, there's a whole chemical way that happens, but basically, and I talked about it just a moment ago, as men age, the production of androgens from the adrenal and the gonads decrease. Estrogen conversion is maintained, but factors cause more testosterone to be what's called aromatized. So we want to limit that aromatization, and we'll talk about that in a moment as well. But you get an imbalance of testosterone and estrogen. So basically you have more estrogen and less testosterone. Therefore, estrogen excess. Testosterone decreases as estrogen remains persistently high. Fat cells increase aromatase activity and convert even more testosterone to estrogen. Remember, what causes more estrogen? Fat cells. So if you got the belly fat as a guy and you're 50 years old, I wonder why we're having so many heart attacks. I'm not saying it's the only thing, but it's certainly a contributing factor. Symptoms, breast, we've already talked about a few of these. Loss of muscle mass, emotional disturbances. You know, it can be just depression, just not being able to recall your words like I am. It's really important to think about this. This is, you know, the chemical structures of all the estrogens in the body. Your body has estradiol. However it got it, it's there. It will go back and forth between estradiol and estrone. From estrone, this is the cancer-causing one. We want to make this. We want more going this way than we do this way. This is a negative estrogen metabolite that we know causes cancer. If you ever go to have a genetic test to see if you're predisposed to cancer, they're going to test for that, and they're going to test for this. If you have an inordinate high amount of this versus this one, you're at a very, very high risk for cancer. But the good thing is you can change this. You can minimize this direction and you can maximize that direction. How do you do that? Well, remember, I've already talked about certain pesticides, plastics, xenoestrogens increases this pathway. This little arrow right here has all these enzymes, has oxidation. If you're giving yourself bad nutrition, you have overweight, you're eating fried foods, you're working in a carpet mill, and sometimes we can't help these things because there again, they're ubiquitous. You're pushing more, and this is men too, you're pushing more of your estrone to this pathway. Now, going to this other pathway is low fat, exercise, and something called indoles. Indoles are phytosterols. Indoles is found in cruciferous vegetables like broccoli, cauliflower, Brussels sprouts. And if we're not eating enough of these cruciferous vegetables, that's why every woman needs to be taking Indoplex. I don't care, even men too. You want this conversion here. This is healthy. This is breast cancer. So what can be done to limit the dominance? I already talked about it. You want to decrease that aromatase activity. There are metabolites that initiate and promote hormone-related cancers. More broccoli, and more soy. To a point, soybeans, of course, will cause more estrogen, but it causes better estrogen metabolism. There's some of the more examples of the cruciferous vegetables that will decrease this aromatase activity. Get rid of the fatty bellies. For men, we want to raise the testosterone if we know it's low, and for women, we want progesterone to balance excess estrogen. But there again, estrogen is not a terrible thing. We have to have estrogen. Maintains bone density, cognitive function, supports arterial wall. So I've talked about estrogen, and if you talk to most physicians and most clinically trained professionals that know anything about the uterus and menstrual cycles, they're going to say that women don't need progesterone if they don't have a uterus or a functioning uterus. That's totally wrong. I have hundreds of studies to support otherwise, but the function of progesterone is to maintain pregnancy. That's the practical use of it. You probably have known people that during the first trimester have had to take progesterone to carry, and Shalena's one of them. So that tells me that you're not producing progesterone even on your best day. You ought to be on progesterone to balance the counter effects of estrogen. But if you ask your gynecologist that, he's going to say, no, you don't need that. Well, I've got studies to support otherwise, and I think it's medical malpractice not to at least consider it. Produced by Cortius luteum, it decreases your thyroid binding globulin when progesterone is low. Antidepressant, it is a natural antidepressant. Orally, progesterone is a natural antidepressant. It can also help with sleep because it occupies those GABA receptors, which is so responsible for sleep. You guys can read this, the functions of progesterone, but this is the most important part here about progesterone when I'm talking about hormone balancing. It's a hormone balancer, and it's antagonistic towards estrogen. So it opposes the negative effects of estrogen because it promotes cell differentiation. It promotes from one cell going to another. Promotes normal cell death. Our cells are supposed to go through a process of differentiating, growing, and dying. What does estrogen cause? It doesn't allow differentiation. It causes cells to grow longer than what they're supposed to. And what's the definition of cancer? Uncontrolled cell growth. So progesterone will help what's called apoptosis to promote the normal cell death. Decreases estrogen receptor synthesis. Remember we talked about how estrogen receptors upregulate. The more estrogen you have, the more estrogen receptors you'll make. Decreases sensitivity, and induces the differentiation through mitosis. Progesterone deficiency it can cause or make all of these things worse. And if you look at it, remember breast tenderness, depression, fibrocystic breast, and that high estrogen? So you have high estrogen symptoms are very similar to low progesterone symptoms. Low progesterone causes low sex drive, fibroid growth, endometriosis, breast and uterine cancer. Guess what? High estrogen causes those too. Water retention, bloating, fat gain around hips, bone loss, hair loss. Guess what? Estrogen causes those too. If you have high estrogen and you have low progesterone, you've got to be feeling miserable, or you're not feeling as good as you otherwise could if you had balancing hormones. Very rarely do we see progesterone excess. Remember I talked about how estrogen receptors upregulate. Progesterone receptors do not upregulate. There is a finite amount of progesterone receptors. When they're occupied, and they're occupied for a long period of time. So if you go to the doctor and the doctor says, or you go to somebody that's got some knowledge about bioidentical hormone therapy, and you're on estrogen, well, let's put you on progesterone because your progesterone's low. So we put you on 200 milligrams of oral progesterone, and you feel better for a while. 3 weeks later, you're back to where you're feeling the same again. The reason why is because you have a saturated effect to the progesterone. Remember what the hormone does. It hits the receptor, and the hormone sends a signal. It's only going to send the signal when it hits that receptor. If all of them are full, there's nothing going on. You can have all this progesterone floating around, but until that progesterone hits the receptor, you don't get this chemical signal on the back end. And progesterone will stick to the receptor for literally weeks, if not months. So the answer is not to give more progesterone if you have progesterone deficiency. There's a difference between progesterone and progestins. Progestins are like medroxyprogesterone. I know you guys have probably never heard of that, but if the doctor says, okay, fine, I'll give you some progesterone, and he puts you on Provera, it's not progesterone. You want bioidentical progesterone. There is something called Prometrium that's an oral, but overall you want a topical progesterone if you're trying to get your progesterone levels back up. Progestins will displace progesterone from the receptors, which doesn't allow for the natural cell death and all the good things. So you don't want to do progestins, medroxyprogesterone. Back in the 90s, there was a women's health initiative. This women's health initiative took 160,000 women between the ages of 50 and 79 and put them in basically 4 study components. Hormone therapy intervention, diet, calcium, plus D. But we're going to really concentrate on the hormone therapy intervention arm. So the hypothesis was that estrogen therapy would decrease heart disease and osteoporosis-related fractures. They measured heart disease and they monitored strokes, pulmonary embolism, endometrial cancer, colorectal cancer, hip fracture, and death. This was supposed to be a 15-year study and a $625 million budget. The biggest study ever. So there were 2 regimens. There was the hysterectomy. The women that had hysterectomy were given just Premarin alone because, as we're taught in pharmacy school and med school, you don't give progesterone if you don't have a uterus. So as a hysterectomy, you don't have uterus. And Premarin is not bioidentical. Premarin is pregnant mare's urine, which is conjugated estrogen, which is not what your body needs to use anyway. They didn't realize that they were about to prove the point that you don't give anything other than bioidentical hormone therapy. And then there was women with the uterus, and they were giving what was called Prem-Pro, which was a mixture of Premarin and progesterone, but it really wasn't progesterone, it was the progestin. What were the results? They stopped it after 5 years because they had a great 26% increased risk of breast cancer, 29% increase of heart disease, 41% increase of stroke, 213% of pulmonary embolism. Remember what their hypothesis was? Hey, this was going to decrease cancer. It was going to be the greatest thing ever. Then After the Women's Health Initiative, they followed up with the women after they stopped it. Abnormal mammogram increased by 120,000. Remember, there was only, what was it, 160,000 people in the study, and 120,000 had abnormal mammogram with Prempro. If a doctor continues to write for Prempro, that's medical malpractice. It's that simple, because we have this to show it. Breast cancer risk increased after 1 year of use, were more advanced when it was diagnosed. Dementia, senility increased in women over 65 years old. Prempro did not improve quality of life. So the package insert on all estrogen receptor therapy says, or on ERT. Forgot what that meant. I'll come back to it. A causal relationship between estrogen replacement therapy and prevention of cardiovascular disease in postmenopausal women has not been proven. They spent $300 million to come to that conclusion. And this was the lead project officer that said it's unproven and acceptable to give hormone therapy, estrogen hormone therapy, for the sole benefit of preventing coronary artery disease. Now, one thing did happen. They had better bones. That way, when they fell over from a heart attack, they didn't break a hip. And I've already pointed out that the biggest hormone fallacy is just because you don't have a uterus, you don't need progesterone. That's wrong. That's kind of like this: penguins are black and white, some old TV shows are black and white, therefore some penguins are old TV shows. That's the same type of conclusions that they're drawing. So another thing that penguins aren't very good at. So what am I saying? Estrogen messages, and I'd probably beat a dead horse, but I'm going to keep on doing it because you guys really need to know that too much estrogen is not a good thing at all, period. Progesterone message to cells is to stop growing and develop. You've got to have progesterone for women to balance it. Hormones have checks and balances, just as nature. When something goes down, something else has to go down with it, or vice versa. We have to have a balance. Estrogen excess and progesterone deficiency can cause identical symptoms in women. So what disrupts balance? This is the more practical aspect of this whole thing. A poor diet, you put junk in, you get junk out. When I do my nutritional talk, I say that over and over. If you put junk in, you can't expect anything other than junk out. Why would you? If you're eating fast food all the time, that's junk. You know it is. Make plans not to do that. Sedentary lifestyle, delayed childbearing. This is interesting. Women who have their first child at a young age have less chance of developing breast cancer. Why is that? Because progesterone levels are elevated at a younger age when breast cancer starts to develop. So you've got high levels of progesterone during that time of pregnancy, and so your estrogen is balanced with progesterone. If you delay childbearing past 30, you've got a very high risk for developing breast cancer because you didn't have that elevated amount of progesterone when you were older, when you had too much estrogen. Stress, alcohol, all these external factors, and the need for cellular detoxification. Get the stuff out. Even if you're eating good, you're still exposed to all these estrogens and toxins all the time. So estrogen deficiency is not the primary cause of adolescent, premenopause, and menopausal health problems in women. That's what we used to think. We're going to talk about those, and we're not talking about menopause. Well, I do want to show you this one though. 7 menopausal dwarfs, itchy bitchy, sweaty, bloaty, sleepy, forgetful, and psycho. The 50-year-olds really laugh at that. Hot flashes are one of the biggest problems that most menopausal women have. We don't really know why. It's a thermogenic effect. I think it's probably because of the high levels of estrogen, low levels of progesterone, causing the thyroid function not to do what it's supposed to because of the poor cellular response. Also, if you know anybody that has a hot flash at night, it could be because of a sudden drop in glucose. Eat a complex carbohydrate snack right before you go to bed. Because when your blood glucose drops, your body wants to stay alive, so it kind of revs things up and it causes your body temperature to go up. And you know, I've said the breast cancer word a few times, but it's a real thing that we need to think of. There are breast cancer markers. Primarily, though, it's environmental factors. It's the high levels of estrogen that I've talked about. And if you do have that breast cancer marker, all the more reason why you've got to keep your hormone levels monitored more closely. Look at this. Estrogen replacement therapy, you have 200 times more likelihood of developing breast cancer if you have zero, if your progesterone levels are not balanced or at zero. If you've been on any estrogen replacement therapy for greater than 5 years, you've increased your chances of breast cancer 20%. I'm not making the numbers up. I mean, I can provide you with the citations if you want them. Current evidence does not support the use of long-term ERT. Whenever I do a hormone evaluation, my goal is to get you on the lowest effective dose for the shortest amount of time of estrogen. Most women need to be on progesterone for the rest of their life after they're not cycling. There's another study that says that you have a 5 times higher rate of breast cancer without when you have progesterone deficiency, also 10 times more likely to die from any cancer comparatively when you don't have progesterone in a balanced effect. Now, I mentioned Endoplex. Endoplex will stop that bad conversion to the negative estrogen, to the better form of estrogen. 1 capsule is the equivalent of eating 8 cups of broccoli. I don't know if you've ever eaten a cup of broccoli, but if you do, you better be alone in a room by yourself, because there's a tremendous amount of flatulence that happens. But 2 pounds of broccoli is in one capsule of Endoplex. Every woman, and now I'm thinking every man, ought to be on this to make sure that you're converting to the good estrogen. Okay, many times this is what happens when you go to the gynecologist, and I don't know why gynecologists will give antidepressants, but they do. So they ask, how old are you? Well, you're less than 45 and you're having these symptoms. Well, let's put you on birth control. Oh, you're greater than 45 because you're entering menopause. Well, you definitely need hormone replacement. And if you're in between there, let's put you on antidepressant, Xanax, and Ambien. You know, you're not sleeping, you're depressed, and you're nervous. If you're no response to therapy, well, let's just scoop everything out. Let's give a total partial hysterectomy.
I didn't know it was so easy to be
It is. Well, and they, you know, they'll be mad at me, but basically they're contributing to a lot of this.
No, it's true. Absolutely.
Vitamin D3 is also important. 90% of Americans are low in vitamin D3. D3 has many new studies to show that it's anti-cancer. You ought to be taking a vitamin D3 supplement. Doesn't take much, about 2,000 units every day. If you're out in the sun very much, you can probably not take it in the summer. But vitamin D3 is extremely important. Testosterone in men, we talked a lot about estrogen, but testosterone, and basically, you need to have your testosterone tested every year. When it gets below 600, you ought to be on some form of testosterone. Remember though, testosterone in too high will convert to estrogen, so you can't just say, okay, I want my testosterone as high as possible. You want it on the high side of normal. But testosterone in men increases muscle mass, helps with bone density, sperm production, increases libido, memory, concentration. We have menopause term for women. We have andropause, andro meaning androgen for men. After the age 30, 1% decline after 30. And actually what I've seen is a lot more than that. Most 50-year-old men, they have 50% of their testosterone that they probably had when they were 25, especially if you're having symptoms. Changes in sexual function, ED, actually even your testicles will shrink. Changes in sleep patterns, you're not going to sleep very well if your testosterone level isn't where it needs to be. And there again, it's not just one thing. Just because you're not sleeping well doesn't necessarily mean you need testosterone, but you ought to have it checked in saliva to make sure. Physical changes, the more body fat, reduced muscle bulk, diminished strength, bone density, gynecomastia, loss of body hair, hot flashes. If these things are going on, you really want to look to see what your testosterone levels are. There is no supplement that will raise testosterone, period. There are things that may give you a better cellular response, like an adaptogen effect, that will allow your testosterone to actually be better used, but you cannot raise your testosterone at all. It's not. You can't eat anything to get it. It's only produced. You do want to get a baseline prostate-specific antigen, which is a prostate test before you start on any hormone testosterone therapy. What are the best ones? Well, there's injections, pellets, and oral. Oral is not effective at all. 99% of it is hydrolyzed in the gut, and you get no effect from it whatsoever. Injections, that'll get your testosterone level up fast, but it will not maintain it. So you'll have to, you get these swings. You'll get, after a week it starts to go down, so you have to give another shot, another shot. There again, there's nothing that's going to keep testosterone raised up. And who wants to go up and down all the time? Pellets are there for 3 to 4 months, sometimes 6 months. You get a good result for the first 2 to 3 months, and then it starts waning. And the doctor's not going to put another pellet in until the predetermined time. So topical testosterone is by far the best way. Most pharmaceutical available testosterone out there is anywhere between $300 and $700 a month. We compound it for $42 and we still make money on it. But it does require a prescription from your doctor. How do we know salivary testing? I have 3 different labs that I work with. Why is salivary more important than serum? Well, I explained over 99% of it's bound up. So if you're not testing for free testosterone, you're not getting an accurate measurement. In saliva, that means it's already passed through the cellular membrane, so it is what's available for the cells to take up. So saliva testing is by far the most accurate way of testing. Now, some of the serum tests are getting better, and there is a free testosterone out there, and they're very comparable. So testosterone is fine to check in the serum if it's free, but there, to my knowledge, is not a free estrogen or progesterone out there unless you do saliva. I went very fast. I left a lot out. I could talk about this on and on. Do y'all have any questions? Have I made at least you know that you need to have your estrogen and progesterone checked?
Can you just talk 1 second? What is that about the free thing you were talking about when someone you were talking about? 99%
of hormones that are circulating are bound up into water, protein, and it's packaged. Unless it's opened up, your cells can't, it's not going to bind to that receptor. It's like going down the 285 and you've got a bag of candy. You've got to keep both hands on the wheel, or you should, at 5 o'clock on Friday evening, and you want a piece of candy. It's like reaching in and grabbing a piece and hoping that you get an unwrapped piece of butterscotch. You may or may not. If you don't, it's not really any good to you, so you throw it away. You get another piece. So only 1% of the circulating molecules of estrogen or progesterone or testosterone or even thyroid is available for your cells to be used at that point. And that's just the way that it is. And so most serum testing does not differentiate between if it's wrapped up or if it's free and circulating for your cells to use at that point. Now, somewhere down the line, it might become unwrapped, but 99% of it, 99% of the time, is not usable. Okay, my talker's about out. I mentioned a few things already, and as Anna discussed what isogenics is, you'll remember some of these things, and I'll kind of interject some of the information about isogenics. But isogenics, I've been on now isogenics for about 4 months, and I've got better energy. Now, if I follow the program, I've got excellent energy, and sometimes you just get off of it. If you don't follow it, it doesn't give you the benefit.